Monsieur le Président, mon cher frère Cyril.
Mr. President, my dear brother Cyril, ladies and gentlemen, dear members of the press, I would like, on behalf of the Congolese government and the government, I would like to warmly welcome His Excellency Mr. Cyril Ramaphosa for his working visit to the DRC. I also extend my greetings to the Republic of Population of South Africa and the delegation that is accompanying you here. Your presence amongst us is showing the friendship and the solidarity and the cooperation that is uniting both of our countries. The Democratic Republic of the Congo and the Republic of South Africa are enjoying strategic relationships based on this history of fights and African solidarity and the common willingness to build a more sovereign Africa, more integrated and more prosperous. The Republic of South Africa remains for the DRC a major partner on the political, diplomatic, security, economic, health and regional arenas. I would like to salute the commitment of your country by the Congolese population side, particularly at the moment or at moments when our country is facing serious challenges. During our talk, we spoke about this response to the Ebola disease response due to this Bundibujo strain currently affecting some of the areas of eastern DRC. And due to this new spike, my country responded urgently and determination, and following the experience acquired during the previous outbreaks, we mobilized significant human, financial, technical, and logistical resources to contain the spread of the outbreak, strengthen the disease surveillance, improve the screening capacity, and provide management of cases and associate the communities to the response. Following the latest report of the task force, 1,120 confirmed cases, of which 290 deaths, thus a death rate of 25%. 408 patients are in isolation and are being taken care of. The government is closely and daily monitoring the situation and taking the necessary steps to protect our population, to prevent the spread of the disease and preserve the health safety of the neighboring countries. The Democratic Republic of the Congo has mobilized so far $50 million, American dollars, intended to strengthen the national response. These resources are supporting the deployment of medical staff, strengthening the labs, purchasing medical inputs, surveillance at border points, management of patients, protection of health care workers, monitoring of contacts, and community awareness campaigns. This shows the government's willingness to make sure that it protects the public health and preserves the livelihoods of our populations. Mr. President, this outbreak reminds us that health security is now still closely related to stakes of peace and human security. In areas affected by armed conflicts, insecurity is fragilizing prevention, epidemiological surveillance, and a fast response to urgencies of public health. The fact that the DRC and the Republic of Uganda are simultaneously confronted with this threat show that the health risks ignore borders and are calling upon a regional coordinated response based on shared responsibility. For a country like ours, located in the heart of the continent and surrounded by 9 other countries, cooperation at the border is a need. In this spirit, the Republic of South Africa, in following its experience and its scientific capacity, its leadership at regional level, and its role within the SADC and African Union, can provide a significant contribution to the collective efforts of response. This contribution could consist on technical support towards epidemiological surveillance, strengthening the lab capacity, experience sharing in emergency management, and regional coordination in the context of the SADC. Your presence here in Kinshasa today is a political strong signal of solidarity, of outreach and responsibility as an African citizen. We also had the chance to visit the facilities of the National Institute of Biomedical Research and Epidemic Surveillance and scientific research to this health response. This visit has highlighted Congolese expertise, the professionalism of our scientific staff, and the need to strengthen the African capacity on the research sector and the disease screening and addressing emergency public health issues. I'd like to express the gratitude of the DRC to our partners assisting our country in this struggle, particularly the Republic of the USA, the Republic of China, the Republic of South Africa, the World Health Organization, UNICEF, Africa CDC, and other humanitarian organizations and field actors. This solidarity shows that outbreaks ignore borders and only common actions can help better protect our populations. The DRC considers that responses to humanitarian issues must be based on scientific data, transparency, and cooperation between states. We need to avoid excessive measures, unjustified measures that disrupt the movements of populations and goods and critical services, as well as humanitarian aid. This current crisis also highlights the need to build more health systems, more resilient and better prepared to future challenges. Africa must strengthen its capacity of prevention, of surveillance, and also screening, as well as research, staff training, and quick response to epidemics. Beyond the health emergency, this official visit also gives us the opportunity to strengthen this bilateral agenda between the DRC and the Republic of South Africa. Both countries have a lot of complementarity in the areas of economic and commercial cooperation, infrastructure, energy, mines, and transformation of natural resources, agriculture, health, training, industry, youth, innovation, as well as diplomatic cooperation within SADC, African Union, and the UN. Together, both of our countries can contribute towards economic integration of Southern Africa, stabilize the Great Lakes region, and build a more robust Africa on the global arena. It is under this spirit that I had the opportunity to invite my counterpart, President Cyril Ramaphosa, to attend the meeting that will share this month the Security Council, the UN Security Council, devoted to the linkages between natural resources, peace, security, and sustainable development. This is a critical theme for the Democratic Republic of the Congo, for Southern Africa, for the Great Lakes region, and for the whole of our continent. The natural resources should no longer be a factor of predation or instability and conflict. They should become a leverage for peace, economic sovereignty, industrial transformation, sustainable development, and shared prosperity. We also discussed of the situation of some African citizens living in the Republic of South Africa and the tensions that this issue may raise. We fully understand that each and every state has the sovereign right to organize in the respect of the laws, the management of its territory, its borders, and its immigration policy. But we remain convinced that this issue must be addressed with total humanity and in the respect of the dignity of the people concerned. So we trust the wisdom of the South African authorities to be in favor of a more balanced attitude in line with the values of African solidarity, so that they can respect all the fundamental rights. Mr. President, my dear brother, your presence this day in Kinshasa clearly illustrates the good relationships between our two countries and our common willingness to build an Africa that is more resilient and more prosperous. In front of this security and economic and humanitarian challenges of our region, the Democratic Republic of the Congo remains convinced that no country can succeed alone. It is together in a spirit of African solidarity and shared responsibility that we can protect our populations, strengthen our health systems, consolidate peace, and promote integration of our continent. I thank you, Mr. President, for your presence and for the kind attention that you are showing in the situation that is in my country, and for your constant commitment of the Republic of South Africa by the side of the DRC. Once again, thank you very much and have a safe trip back home in South Africa to you and all your delegation.
Thank you, Program Director. Forgive me that today is Thursday. I only speak French on Wednesday. So I left my French at home in South Africa. You see, even the microphones are in French. Your Excellency, my dear brother, President Félix Tshisekedi Tshilombo, ministers and deputy ministers, the Director General of the Africa Center for Disease Control and Prevention, Dr. Kaseya, the leadership of the National Institute of Biomedical Research, representatives of the international organizations that are here present, and representatives of the donor community that are also here, and representatives from the scientific and research community, and the representatives of the wider healthcare sector, including the World Health Organization, distinguished guests, and ladies and gentlemen. Allow me, my dear brother, to start off by thanking you for inviting me and my delegation to visit your country in my capacity as the African Union champion on pandemic prevention, preparedness, and response. Earlier today, President Tshisekedi and I had an opportunity to discuss the ongoing Ebola outbreak and broader matters of regional health security. This visit by myself and my delegation is aligned with the mandate of the African Union champions, which is to provide oversight, to also help to mobilize resources, to strengthen cooperation amongst member states, and to support coordinated continental action. Beyond the deep and enduring bilateral relationship between our two countries, we are here to express our solidarity with the government and the people of the Democratic Republic of the Congo as they go through this very difficult time of having to deal with Ebola. On behalf of my government and the people of South Africa, we express our profound condolences to the Congolese people who have lost loved ones and extend our sympathies to all who have been affected by this outbreak. We know very well how families and communities are affected by a pandemic such as this one, having lived through COVID-19 a few years ago. We also salute the health workers, the scientists, the humanitarian personnel, as well as community leaders who are working tirelessly on the front lines. Throughout many periods in our collective history, the resilience, the courage, and the selflessness of our peoples have enabled us to weather even the worst of difficult times. We have no doubt that this crisis too shall pass, and that we too shall overcome. The people of Africa are one. Our bonds transcend borders. They also transcend ethnicity, language, cultures, and all other factors that could seek to divide us. When there is tragedy in one part of our beloved continent, we all share in the sorrow that has befallen one. When a sister country needs assistance, we answer that call. The continental response to this Ebola outbreak has been swift. On the 16th of June, President Ndayishimiye of Burundi convened a virtual summit of African leaders and partners to deliberate on a global response. The meeting mobilized approximately $1.5 billion in financing, also in technical support, as well as medical countermeasures and humanitarian response. It is significant that this amount, over $100 million, was pledged by African countries themselves. This counts as a precedent-making development that African countries themselves are taking the assistance they should give to one another seriously. This also reflects the spirit of solidarity and cooperation that we continue to see in pursuit of African health sovereignty. Given the magnitude of this challenge and the urgency with which we have to contain the outbreak, that we have to treat infected and support those who are affected, it will be critical that these resources are well managed, and we have no doubt whatsoever that they will be well managed. We welcome the medical supplies tracking dashboard established with the support of the World Health Organization, together with the inventory and donation coordination mechanisms that will strengthen accountability and also improve the alignment of partner contributors. Now, despite the challenge before us, we draw hope from the dedication and commitment of all partners who are also gathered here today. And I listen very carefully to some of the commitments that have been made, not only by various partner countries, but by organizations as well. And we are grateful and we thank you for that. Having witnessed patients' recovery from this disease, we are encouraged, as Dr. Kaseya was saying, that the continued development of medicines and vaccines will yield even more promising results and improve recovery outcomes. I do share Dr. Kaseya's hope that we should be able, as we work very hard, to even have a vaccine for this variant of Ebola by the end of this year. We are hopeful that the virus will remain contained and will not threaten other regions of our continent or indeed the world. And this is where we call upon other countries not to lock out the DRC. Do not impose travel bans on people traveling from the DRC. Locking out travelers who you may suspect may be infected with a disease is not the way to treat the travel opportunities of people in the world. We are hopeful too that there will be minimal disruptions to lives and livelihoods, and that economic growth and social solidarity will continue beyond this public health shock. We're mindful of the serious challenges that still lie ahead and continue to confront us. We value this engagement that we've just had today because your experiences and insights are essential in ensuring that our political interventions are grounded in the realities faced by frontline responders and affected communities as well. We wish to reiterate several proposals aimed at addressing the challenges that persist. Firstly, we need to rapidly convert the pledges that have been made, and there are many of them, that they should be converted into financing technical assistance as well as the deployment of much needed medical countermeasures. Secondly, we need a ceasefire in the area where Ebola has broken out, where there is still war that is raging. This is needed to allow the safe passage of humanitarian assistance, healthcare workers as they work to curb the ravages of this disease, and the medical supplies that need to be transported to those who are affected. War is not the answer during times like these. This is the time when there should be a ceasefire In fact, this is the opportunity that this outbreak should be the catalyst for a permanent peace. We appeal to every community to stand with and protect our frontline health workers as well as volunteers. These frontline workers and volunteers are risking their lives to save the lives of others, and they must never face fear, stigma, or violence while serving our people. Thirdly, South Africa remains committed to investing in African innovations and local manufacturing capacity. In this regard, we are supporting our manufacturer, Afrigen, as it participates in efforts to develop a vaccine against the virus of Ebola that has broken out. And I want to applaud the leadership of the facility that we visited this afternoon, together with my brother, President Tshisekedi. I saw young researchers, I saw committed administrators of the research facility that we visited, and I saw a professor who's dedicated to continue developing a number of these researchers, and he has already produced a number of PhDs. And I applaud him, and I applaud all those who are working in that facility. I was hugely impressed that we've got a world-class facility here in Kinshasa, in the DRC. This is how Africa repeatedly continues to demonstrate resilience in the face of health crises and danger. Out of Africa, there are gems that are emerging, that are showing the way to a good future. What is required now is unity of purpose, urgency of action, and sustained solidarity. It is this solidarity that has brought us here from the Republic of South Africa to the DRC, to come and pledge our solidarity even in the face of danger of a virus, because we do believe that it is through solidarity that as Africans we can advance our interests. I had very long and deep discussions with President Tshisekedi about a variety of matters that concern the peoples of Africa, including the challenge that South Africa is going through now on the migration issue, as he mentioned. And I want to echo the message that he delivered here, that whatever challenges that various countries, including South Africa, may be facing with regard to migration, the issue of migration affects all of us. And indeed, it's an issue that is raging all over the world. And his caution and his very kind message that it should be handled with due care for the lives of all who are affected, that is precisely what we are doing in South Africa. We are guided by our constitution that promotes the respect for human rights, the dignity of others. Yes, we face this challenge where a number of our countrymen and women have been protesting against the presence of people from other countries. The government of the Republic of South Africa is firm in saying that we have a duty to respect the rights of all people on our continent. And we also have a duty to protect all people who live in our country and ensure that they are not subjected to violence, and ensure that all of us, South Africans and otherwise, respect the rule of law. 2 days ago, we had a nationwide protest where our security forces ensured that law and order is observed, even as a number of people in our country were protesting, but our security forces were firm in making sure that the respect of all people, including foreign nationals, is respected, whether they are documented or not documented, that their dignity, their lives are protected. Yes, those who have been protesting because they are concerned about their own livelihoods, arguing that they don't have employment, they're poor. Our government has heeded that, but it has also heeded the quest for safety and security by those who may not be South Africans. The balance that President Tshisekedi is talking about is precisely how we are seeking to handle this whole challenge. It is a challenge that we are handling with due care for the rights of those who are saying that they are unemployed and they are poor in our country, and as well as the rights of those who may not be properly documented in our country, and saying they need to be treated with dignity and safely, and they should not be subjected to any form of harassment or injury. That is a balance that our government has decided on, but we've also said that we will be sending out envoys to the rest of the continent so that we can have proper discussions to discuss the whole issue of migration on a balanced basis. And we've also said that we'd like to cooperate with all countries that may have their nationals in South Africa. The issue of migration cannot be handled by one country alone. We need to work together as African sister countries to address it and find solutions that will be fitting to the problem that we now have. And President Tshisekedi, I thank you for your kind message. The same message has actually been delivered to me by a number of other heads of state who have said, as you have said, you understand the challenge that we are facing. We're facing a challenge from South Africans, but we're also saying those who are not South Africans' rights must be respected. And therefore, a balanced solution needs to be found, and that is why we're calling on cooperation from our sister countries at the leadership level as well as at the citizens level, so that together we may move forward. I would say as I end that all countries will say that they require that everyone who is in a country should be properly documented as they are in the country, because that in a way gives security, that in a way entrenches the rights that anyone would have. So therefore, with that message, we are saying to our African brothers and sisters, let us work together to resolve this problem. In the end, I'd like to thank you, my dear brother, President Tshisekedi, for welcoming us once again to Kinshasa and for spending the entire day with us dealing with matters of health, of security, and other global matters, including the matter I've just touched on of migration.